Welcome to another episode of Mental Wellness Insights. In this episode, our guest, Dr. Erica Holmes, Director of Psychological Trauma Studies at Antioch University, Executive Director of Champion Counseling Center in Los Angeles, and an author, speaks to us about trauma. So thank you for accepting to join with us. We will just start right away with you introducing yourself.
Well, thank you so much for having me. My name is Dr. Erica Holmes. I am a licensed clinical psychologist in the United States, specifically in the state of California, the city of Los Angeles, California, to be exact. And I'm so happy to be with you.
Yeah. Today we want to discuss about trauma. And I know that you are an expert in that. What is your organization called?
So I actually work for two organizations. I actually work as a professor at a university in a master's program, Antioch University, Los Angeles, where I direct the psychological trauma studies specialization, which is a sub-area of specialty that students can choose. I also am the executive director of Champion Counseling Center, which provides direct psychological services to women, children, couples, and families.
Yeah. And you have done a lot on trauma.
Yes, I have. I've been working in the area of trauma since for about 22, 23 years now. I actually did my dissertation in my graduate program on trauma, looking at unresolved trauma and crack cocaine use in African American women here in the United States. And that was back in 2000. And I've been working and studying trauma since. I have a postgraduate certificate in the area of psychological trauma as well that I received in 2014.
Oh, okay. Now, could you please tell us what is trauma?
Well, trauma has a lot of definitions, but really when we think about trauma, we think about trauma in two ways. People will use the term trauma to talk about the event, or they'll use the term trauma to refer to the symptoms after the event. So, for example, a person will say, I experienced a trauma over the weekend. When they say they've experienced a trauma over the weekend, they're talking about the event. Something happened to me. Or sometimes people will use the word trauma to refer to the symptoms after the fact. I was traumatized, or I'm living with trauma. So when we think about trauma really is psychological trauma really refers to highly stressful events, unpredictable, stressful events that overwhelm a person's usual way of coping. So it's not necessarily the event. The event could be potentially traumatizing, but it's how that event impacts the individual that is experiencing it that causes later symptoms. So it is a event that's out of a person's control, that is highly stressful, that overwhelms their usual way of coping, that causes a person to experience symptoms of psychological trauma.
Okay. Can we probably have examples of such?
Examples of things that might cause a person to be traumatized?
Yeah.
We really think about things that cause symptoms of trauma and also the diagnosis of PTSD. So PTSD is not trauma, it's a diagnosis that can occur afterwards. So we really think about those things as things that are life-threatening, that are threatened or potential death, threatened or potential serious bodily injury, like an assault, a robbery, sexual assault, things like domestic violence. Things that cause or could threaten death might be a car accident, a plane accident, some life-threatening accident, life-threatening serious assault, being held up by gunpoint, being robbed, being physically assaulted, and also sexual assault, and that could be sexual abuse as a child and or as an adult. So those are some examples of the experiences that are often highly trauma inducing. There is also are also trauma syndromes that can occur from things like disrupted attachment as well. So a child being taken away from a caregiver or a loved one could induce trauma-like symptoms in that child, for example.
Yeah. And how does trauma present itself? How do I know that I or somebody else has trauma?
So we really think about the residual impacts or effects of trauma to make it easy in four broader categories. Mm-hmm. So what happens when a person experiences trauma in the brain and in the body is that there's difficulty in calming or relaxing what's called our central nervous system. So the person might be hyper aroused. That means that they're on edge, they're jumpy, they're irritable, they're easily startled. Like if something happens, they're easily startled, they're fidgety, so they can have difficulty sitting, concentrating. So there's this hyper physical arousal that happens within the body. They might have trouble sleeping, things like that. Another way that a person might know that they've experienced trauma is that they have symptoms of avoidance. So they avoid reminders of the traumatic event. That could be avoiding people, places, or thoughts. So they don't want to be in the place where it happened or somewhere near a place or that reminds them of the place that it happened. It could be, the reminder could be a smell of the place. The reminder could be an actual place. If they were assaulted in a car, they might not want to be in a car. If it was a red car, they might feel anxiety or those symptoms when they see a red car. They don't want to think about the event or talk about the event, so they avoid the feelings, emotions, and thoughts that come from the event. And they might also, again, avoid people that remind them of the event. So you have hyperarousal, you have avoidance. Another symptom might be intrusive symptoms. So they think about it a lot, ruminating over the event a lot. They might also have flashbacks and nightmares where the pictures and the memories of the event come rushing through, and it feels as if it is happening all over again. So it is what we call a living memory that intrudes their waking moments. And that's the same with like nightmare and night terrors of the event. So those intrusive memories and thoughts and pictures invade the mind. And then a longer lasting symptom might also be what are called alterations in negative cognition and mood. So that means that the person develops negative mood symptoms, maybe depression, maybe anxiety, maybe panic attacks. So they develop other symptoms in their emotional expression and also in their thoughts. They may develop thoughts, what we call kind of like the cognitive triad. They have negative thoughts about themselves, they have negative thoughts about the world, and negative thoughts about the future. So examples of negative thoughts about the self might be, I'm incompetent. I'm incompetent to keep myself safe. I'm unworthy. I can't make good decisions. I'm not able to protect myself. I'm unlovable now. Thoughts about the world, that includes other people. the world is dangerous.
Yeah.
People can't be trusted, right? In the future, it's not going to get better. This is the way that the world is. This is the way that people are, and I'm not able to protect myself. So these thoughts about themselves, what they can expect from the world and other people, and what they can expect from the future, become negative and self-defeating and causes limitation. So those are really the four areas that we see symptoms: hyperarousal in the physiological sense, avoidance of thoughts, reminders, people and places, intrusive symptoms, flashbacks, nightmares, ruminating thoughts, and then negative cognition and mood changes, shifts in mood, and also the ways that we think about ourselves, the world, and the future.
And do they tend to be suicidal? Do they tend to be suicidal? Yeah. Do they?
Suicidal ideation most definitely can come, especially when you think about living with the nightmares and the flashbacks, and also the negative cognition mood. If I think that I'm bad, and I'm constantly on edge, I'm in pain. I'm in emotional pain. I'm in psychological pain. And oftentimes, what the literature and suicidal literature around suicide, I should say, often highlights is that a person who's suicidal doesn't necessarily want to die, but they want the pain to end. And after a traumatic event, the survivor can be in constant psychological, emotional, and even physical pain, depending on the nature of the assault.
Mm. Now, before we go to the healing process, what is post-traumatic stress disorder?
What is post-traumatic stress disorder?
Yes.
That's the question?
Yes.
So post-traumatic stress disorder is one diagnosis that a person can have as a result of experiencing trauma. So the diagnosis of post-traumatic stress disorder, or what we call PTSD, has very specific criteria, meaning there are specific symptoms that an individual experiences after they have gone through a traumatic event or a traumatizing event. Mm-hmm. And it really, the criteria clusters around some of the things that I've already mentioned, which is that the event is life-threatening, body-threatening, or sexual assault. Then there are clusters of symptoms that are intrusive or avoidance or hyperarousal or negative cognition and mood, but it's a specific disorder. There are also other psychological syndromes and diagnoses that a person can have as a result of a traumatic event, such as acute stress disorder, which occurs very soon after the traumatic event, might last between 0 to 30 days after the traumatic event. A person might also experience co-occurring disorders like depression, anxiety, panic attack, but PTSD is one of the disorders that can occur after a traumatic event, and it actually is one of the first that was diagnosable, known to have an etiology or resulting specifically from a traumatic event.
Okay, now let us talk about the healing process. How does one gets to be healed?
Right. So there are, several ways that a person can begin the healing process. As a licensed psychologist, a therapist myself, of course, seeking professional help, and sometimes that's not available. It might not be available because of where people live, because there aren't many practitioners, or even because of financial resources.
Yeah.
So it can be very difficult to do. However, with now online communities, people can do research and search out survivors groups, for example, that are online, that they can do remotely. But it's important to have support around these issues. There are also books that are written that you can order from the general public that can give you information to kind of engage in some self-help if you're not able to get to a survivors group or get to professional help. There are books such as The Body Keeps the Score, which are available on Amazon and other big book distributors. So The Body Keeps the Score was written by a Dr. Basil van der Kolk, for example. He has a great book that you can read. There are also workbooks, Working Through Intergenerational Trauma, the PTSD Healing Workbook. So there are workbooks that you can Google that you can find. But what's important is for you to recognize and acknowledge the symptoms that you're having, and then find resources and also activities that can help you to kind of restore a sense of balance and a sense of peace. It's very difficult to kind of do that on your own. Having some support is really, really important and necessary. And that might also be communal supports or family supports if your family is supportive.
How does trauma affect the family and relationships?
So a traumatic event can have a serious effect on a person's ability to make meaningful connections, because again, especially if the trauma was at the hands of another person, people may begin to feel that people are untrustworthy. So they might isolate themselves from their family. Sometimes they might not discuss or disclose what has happened because they feel their family might reject them or not understand. The behavioral changes that a person might experience as a result of the traumatic experience might have their loved ones, their friends, their family feeling attacked, pushed out, not valued or not wanted. So trauma can be very isolating for the person and also the loved ones who are trying to help. Sometimes when a person experiences a traumatic event, they feel alone. No one can understand what I've gone through. No one can understand me. No one, will be able to support me because they don't understand. So it can cause isolation, and it can cause the family and the friends not to truly understand why is the person acting or behaving this way.
Thank you very much. Is there anything you think we should have included and we haven't?
The one thing that I think it will be important for trauma survivors to know is that the symptoms that they have as a result of trauma are the body's natural responses to an abnormal experience. And what I mean by that is that your body and your mind have not betrayed you. They're doing what they were created to do in order to protect you as you were experiencing whatever happened, to help you survive, to help you to survive. Now, what happens if you're having symptoms after that is we just have to teach your body how to go back to its normal baseline level. But you're not abnormal. What you're experiencing after is actually your body's normal response to try to protect you. And the symptoms are very common. You're not alone, and you can heal and get better.
Do you think, is it possible that somebody can experience a traumatic event in probably childhood and live with it throughout their life without knowing that it affected them? For example, somebody was defiled in childhood? Is it possible for the person to live their life without knowing?
Most definitely. Most of the adults that I work with, they're coming in at 35, 40, 45, having lived their entire life, but things are becoming challenging. They're noticing that they don't really have connections, they don't have friendships, they're having difficulty parenting. So they're noticing that they're having difficulty excuse me, and they don't know where it originated from. And after exploration, I find out that there was some early childhood trauma. And so that trauma has been carried with them, but they never received help. No one ever explained to them how trauma affects them. And so they've lived with them. But the residue of that trauma has truly informed their lives and the way that they move. Most definitely.
Oh, okay. Thank you so much. We have covered a lot in the short session, and I believe this is the beginning. We are going to have more time to discuss issues involving people, the communities that we live in. So I want to thank you very much for joining us today, and looking forward to another time. Thank you for watching this episode of Mental Wellness Insights. We hope that you have learned something about trauma, and you will be able to help yourself or help somebody who is passing through a traumatic event or who has passed through trauma in their earlier life. Please comment, like, subscribe, and click on the notification bell. Blessings.